If we're going to talk about alternative treatment, we have to say alternative to what? And when most people talk about alternative treatment, they're talking about alternatives to what we would call standard of care. So I don't want to come across as totally bashing standard of care because they've got some great tools that we could use. But I do have an issue with standard of care when they produce crappy results. And what they've done is they've kind of monopolized everything. And they've done it highly through the pharmaceutical industry. They've made it so that there can't be studies done on alternative outcomes because they refuse to do the studies. And I have a big issue with that. And I'd like to address what standard of care is and what's good about it and what's bad about it here. So when we talk about standard of care, first and foremost, we're talking about medicine and using medicine as a tool. I think medicine can be a fabulous tool, and they've got marginal proof of some of the advantages and how it works. And what I mean by that is they do studies, and they do studies based on medicine versus a placebo, a phony pill. And then they say we got 30% results with the phony pill, and we got 31% results with the real pill, and therefore it's a standard of care now. It's a proven treatment. The problem is treatment for what? And like I said in a different video, treatment to marginally lower the intensity of our states, marginally improve the distance between one state and another, the time, and that's about it. And maybe temporary remission, but that's about what we're measuring. We're not measuring whether people are more functional or not. We're not measuring whether people can understand this at a level where they can function and see advantages in their depressions and the mania. That's not even part of the system. You know, I sat down for over an hour, had dinner with Aaron Beck, the guy who founded cognitive behavioral therapy. He admitted that he has never produced results like ours. The best they can do with therapy is help people to get some marginal improvements. That doesn't mean therapy's bad. I'm a huge fan of therapy, especially marriage and family therapy that helps us fix our relationships and make them work better. But the therapies that are based on remission, can we help somebody not have the states? Flat out do not create bipolar in order. So my issue isn't with some of the strategies and all of that. With those tools, my issue is they're not producing the results that are even remotely comparable to the results that bipolar in order is creating. And I have a problem with that, frankly. So standard of care is medicine, it's therapy, it's electroshock, it's treatments that are all geared towards getting us towards remission or like I said, a little less intensity of our states. Good things. There are times when those things are important. The way I see it is the alternatives to that tend not to be strong enough. So we want to say, put tools in their right perspective, like we talked to in a different video here. Part of the use of tools is to lower the intensity of the state. It's a great use. You know, another part of the use of tools is to raise the intensity of the state. If I'm depressed, I want to raise the intensity of the mania. Move me in that direction. If I'm manic, I want to move myself in the direction towards depression. So tools aren't a one-way ticket. I can use a tool that moves me in a different direction because the direction I'm in has gotten too intense for me and I need to back it down. So we need to look at all of these tools in that kind of a way. Another thing we want to look at for those tools is I would much prefer to use a non-invasive, no side effect kind of tool, which is where the whole idea of alternative treatments came from. We're being coerced and forced and highly pressured to take these combinations of drugs with these terrible side effects because they're strong enough to produce some of these results that we're talking about, the lowered intensity of the state, which is important stuff. So back to those study ideas. They talk about these studies, but then they act like a witch doctor or something, and they combine this med with this med with this med with this med. There is no study out there about these combination of meds, yet they're doing them to all of us all of the time. So they're holding up their studies as why we should make these the standard of care, and they're poo-pooing everything else, and at best, they're saying these alternative treatments are kind of an adjunct to the main program. They're just supplemental. They're not an alternative. We'll kind of throw those in on the side. That's where another bone to pick. They hold up their doctoral degree and they go, I've got these really high qualifications and I've been the chairman of the department and the top doctor in its field, and I'm so open-minded that I look towards alternatives. And they take an alternative like meditation, which is probably better and more effective than any of their tools if it was taught by somebody who actually had the skill set. And they say it's really important that I should go to the best doctor in the field. But you know what? My nurse took a yoga class last week, and she's going to teach meditation because we don't recognize the skill set that's needed to be an expert at that field. So there's a lot messed up with standard of care. There's a lot messed up with that, which is why people are seeking these alternatives. It doesn't mean we need to throw it out. It means we need to recognize when is appropriate to follow their advice, what use we can do with them, but we need to get to the point where we know more about it than they do. And frankly, I've met with the heads of departments, some of the top people in the field like Aaron Beck and others, and I ask them, what is your interest in bipolar? And they usually kind of say, I found it interesting in my residency when I got out of medical school, and that led me to a lifelong interest in it, but I don't have it myself. So they don't have firsthand experience. And then I tell them what I'm doing, and they smugly say, oh, we do those kind of things. We help people become aware of their states. And then I say, tell me what it's like for a person to be at a 30% depression. Tell me what it's like. And they go, well, here's what my patients tell me. They say they're exhausted, tired. They say they're sad. It's somewhat overwhelming. And they say they can't get out of bed. And I'm like, is that it? Yeah, that about does it. They don't understand it like we do. They don't get it down. They don't have the awareness piece that Bipolar In Order has. They don't have a sophisticated system that's producing phenomenal results. They don't even have results that they're willing to compare to the ones that we produce. That's what we should be talking about alternatives. We should be saying who's producing the best results of anyone and what are those? And let's hold up the best results we've created. People who say and prove there is no level of depression that overwhelms me anymore. I can function in all of it. As a matter of fact, there are times when I can see that that depression is an advantage in my life. Let's hold that up to, well, I'm not as depressed as often and it's not as intense, but it still sucks. They don't compare. So let's move it from alternative tools to alternative outcomes, alternative treatment to alternative outcomes.